Good day, everyone. Today, I'm so happy here to present the comprehensive work of cardiometabolic medicine in Peking University Third Hospital. And this presentation encompasses our initiatives, outcomes, and the future perspectives in addressing cardiometabolic challenges. As well known, diabetes is a growing burden of disease around the world, especially in developing countries and undeveloped countries. And in China, also, diabetes is a critical factor for coronary heart disease, supported by substantial research. So, many international cardiology societies, such as ACCHA, ESA, and other major international cardiology societies have issued consensus or guidelines calling on cardiologists to actively participate in the management of diabetes patients, especially those with ASCVD. In this situation, under Professor Tang's leadership, our hospital set up the cardiometabolic team. We include not only cardiologists, but also endocrinologists, nephrologists, pharmacists, nutritionists, and nurse practitioners, and behavioral psychologists and rehabilitation staff to make sure give the patient well-rounded, comprehensive care. Everyone in our team has his own responsibility. And our clinic was established on October the 30th, 2020. We treat a range of conditions from obesity and metabolic syndrome to early chronic kidney disease and genetic presentation for coronary heart disease. This is our cardiometabolic clinic procedure. Patients enter our system through referrals or as discharged inpatients requiring ongoing care. Stable cases will stay under cardiometabolic management, while severe or non-standard cases are referred to specialized departments, such as if patients with DKA, he will go to the endocrinology department. If he has chest pain, he will go to the cardiac intervention team. And if he needs weight loss surgery, he will go to the general surgery team. And our team's expertise spans from diabetes, hypertension, lipid disorders, to comprehensive cardiovascular exams. We also keep up with the latest guidelines and drugs, providing holistic lifestyle intervention strategies. And the nurses also play an essential role by gathering medical data, educating on lifestyle changes, and guiding medication adherence. They also support follow-up appointments and patient consulting. This is our workflow. Our workflow is well structured. The workflow illustrates the process from patient admission to follow-up consultation, highlighting the importance of regular assessment and team intervention. We assess our patients using a comprehensive model that includes medical history, clinical examination, metabolic indicators, and test for early target organ damage. And we also utilize questionnaires and skills to assess a patient's physical activity, depression levels, anxiety levels, nicotine dependence, and diet habits, and sleep quality, and the medication adherence. And this is a checklist. This checklist outlines the follow-up schedule for our patients, including medical history, physical examination, evaluation skills, and routine tests. And for patients requiring additional care, we have a checklist for follow-up procedure, such as electrocardiograms, echocardiograms, and other specialized tests. Led by Professor Tang, our familial hyperlipidemia clinic team also can provide multidisciplinary service for patients with familial hyperlipidemia and refractory hyperlipidemia. And we also participate in weight loss and metabolic surgery multidisciplinary team. This team includes cardiology and endocrinologists and other specialists to provide weight management solutions. We actively implement new therapies and non-drug treatments with significant reductions in medication non-compliance and improved patient management outcomes. In our clinic, we have observed a significant improvement in the attainment rate of target levels for blood pressure, blood lipids, and blood glucose among our patients. And we also emphasize ongoing management of patients after the clinic. We can see patients' medication adherence, diet habit, exercise, and physical level, and sleep quality and nicotine dependence are all in an improved state. And patients can have big improvement after our integrated management. We can see patients have reducing weight, lowering BMI, and their waist-hip measurements can also be improved. Hypertension and diabetic patients experience significant reduction in systolic and diastolic blood pressure, fasting glucose, and A1C. Among hypertensive patients, systolic blood pressure decreased by an average of 9.8 millimeter of mercury from baseline, and the diastolic blood pressure decreased by an average of 3 millimeter of mercury. And among diabetic patients, we can see fasting blood glucose decreased by an average of 1.2 unit. And patients also see substantial improvements in their lipid profiles and uric acid levels, such as we can see HDL-C levels can increase by 0.05 unit. Our comprehensive management is aimed to reduce the occurrence of future cardiovascular events for our patients. To assess the improvement in patients' cardiovascular event risks, we utilize the China PAR score. We can observe significant differences between baseline and the final follow-up China PAR score, emphasizing the effectiveness of our interventions. And also for patients with diabetes, the Score 2 diabetes score is introduced for their cardiovascular event risk judgment. So the Score 2 diabetes score serves as a valuable tool for assessing future cardiovascular risk. We also evaluate the score to understand the risk in our diabetic patients, and we can see the Score 2 diabetes score also reduced effectively. And we also proudly contribute to postgraduate education to foster a new generation of cardiometabolic specialists. And our cardiometabolic training course has been held regularly. It draws experts and promotes knowledge sharing on metabolic disorder management to put forward future medical progress. And we also set up the rescue platform. The platform is set up to collaborative research. And based on our clinical practice and epidemiological cohorts, we have made several novel findings. including glucose spectrum, lipid-related indicators, thyroid functions, and novel serum markers, and new management model, and others. And yesterday, just in the Great Wall Conference, our team was awarded a plaque by ACC. The ACC gave us the plaque for successful participation in defining care delivery in cardiometabolic clinic. So it's a great honor for our team's work. With ongoing studies and continuous learning, we aim to expand our understanding of metabolic cardiovascular disorders and develop innovative management strategies.